तो हेलो गाइस, आज के लेक्चर में हम लोग थोरेक्स के बोन्स को डिटेल में पढ़ेंगे। थोरेक्स जिसको हम लोग चेस्ट भी बोलते हैं। थोरेक्स दैट इज ऑल्सो नोन एज चेस्ट इज अ क्रूशियल पार्ट ऑफ द ह्यूमन स्केलेटन सिस्टम. It consists of bones that provide protection of vital organs such as heart and lungs, assist in breathing also, and it is also play a severe role in attachment sites for muscles. So it consists of three important bones. First one, sternum, ribs, and thoracic vertebrae. So start with sternum. Sternum is further divided into three parts: manubrium, body, and xiphoid process. Manubrium is the upper part of the sternum, that is trapezoid in shape and articulate clavicles and first and second ribs also. The articulation point of the clavicle is known as sternoclavicular joints. So that's the point. And also this middle part is the body, that is also known as gladiolus, and it is the longest part of the sternum and articulate the second to seventh rib through costal cartilages and form a protective layering for the heart and large blood vessels. So the further part is the xiphoid process, that is the inferior portion, and it is the smallest and most variable part of the sternum. It consists initially cartilaginous, but it ossifies into adulthood, so usually by age 40, and serves as an attachment site for muscles such as the diaphragm and the rectus abdominis. So let's go to the ribs. There are two types of ribs. I am showing. So this is our ribs. Here you can see ribs have curved flat bone and that form the case to the protective case to the thorax. They are also classified into three types based on their attachment to the sternum. Like first one is true ribs, that is first to seventh ribs, and second one is false ribs. Here you can see that first rib, second, this is the first rib, second rib, and here it's at seventh ribs, sixth rib, and this is seventh rib. After the seventh ribs, there is starting of false ribs, that starts from 8th to 10th ribs, and after the 10th rib we have floating ribs, the third type of the ribs. And these ribs also divided into another types in the by their anatomical parts. Ribs have facets, head and neck, tubercle, body, and that's all. So the body have contains the costal group, which is house of intercostal nerves and blood vessels, which is an important question. This is costal group, that is very important thing. These are the facets. This is the head, and this is the neck, and this is the articular facet, tuberculum, and angle, that is called angulus costae. So it's divided into two types, like first is atypical and second is typical also. So atypical ribs starts with first, second, and 10th and 12th ribs, and rest of them are all are typical ribs. And typical ribs, this is the, like I am showing this in 3D view, is the typical rib, but we have also atypical ribs. So in atypical ribs, there is the first rib, that is short, broad, and highly curved, and second rib is larger than first rib but still atypical in shape, and 10th and 12th have only one single articular facet on their head. You can see there, that is two. First one is there superior and second one is inferior. So this is the 10th and 10 to 12 rib is only one single articular facets. That is also floating ribs. So that's all the ribs, and we have also thoracic vertebra. So it's very important thing. Thoracic vertebra consists from T1 to T12, and it's a vertebral body, vertebral foramen, transverse process, costal facets, and spinous process. T1 is T1 has a full facet of first rib and demi facet for second ribs. Rest of T10 to T12 is only one facet on each side for rib articulation, and T11 and T12 do not have transverse costal facets, which is to remember. So functions of the thorax bone is protection, respiration, and also support and stability and muscles attachment. Respiration means like it's work with the intercostal and diaphragm to expand and contract our thorax during breathing. So let's go to the read book. I think it's time to. This is Murray's book, so it's very good book. The thorax is the superior part of trunk between the neck and abdomen. The thoracic cavity is surrounded by the thoracic wall, containing the heart, thymus, distal part of trachea, and most of the esophagus. To perform a physical examination of a thorax, working knowledge of its structure and vital organs is required. So it's not important yet. I'm just giving the intro. So start with thoracic wall. Thoracic wall consists of skin, fascia, nerves, vessels, muscles, cartilage, and bones. The function of the thoracic wall includes protection and thoracic abdominal organs, resisting the negative internal pressure generated by the elastic recoil of the lungs and inspiratory movements. So providing attachment for and supporting the weight of the upper limb, and provide attachment for many muscles of the upper limbs, neck and abdomen and back muscles, and the muscles of respiration also. The mammary glands and breast are located in the subcutaneous tissue overlying the pectoral muscles covering the anterior lateral thoracic wall. Skeleton, thoracic skeleton form the osteocartilaginous thoracic case. Osteo means bone, cartilage means cartilage, and thoracic case is the case-like thing. The thoracic skeleton includes 12 pair of ribs and costal cartilages, 12 thoracic vertebra and intervertebral disc, and the sternum. Costal cartilage form the anterior continuation of the ribs, providing a flexible attachment at the articulation with the sternum. You can see in the figure 4.1a. The rib and their cartilage are separated by intercostal space, which are occupied by intercostal muscles, vessels, and nerves. Like I have a mnemonic for that, VEN, like vessels, vein, artery, and nerves. So thoracic aperture, there are the thoracic communicate with the neck and the limb through the superior thoracic aperture, the anatomical thoracic inlet. Structure entering the leaving the thoracic cavity through the aperture include the trachea, esophagus, vessels, nerves. The adult superior thoracic aperture measures approximately 6.5 cm anterior posteriorly and 11 cm transversely. Because of the obliquity of the first pair of ribs, the superior thoracic aperture slopes anterior inferiorly. The superior thoracic aperture is bounded posteriorly by T1 vertebra, laterally by the pair of ribs and their costal cartilage, anteriorly by the superior border of manubrium. The thoracic cavity communicate with the abdomen through inferior thoracic aperture, the anatomical thoracic outlet. The diaphragm closes the inferior thoracic aperture, separating the thoracic and abdominal cavity almost completely. The inferior thoracic aperture is much larger than the superior thoracic aperture. Structures passing to or form the thorax and abdomen pass through opening the diaphragm. It's mean the structure passing to or form the thorax and abdomen pass through the opening in the diaphragm. Diaphragm is the inferior muscle of the thorax. Example: inferior vena cava and esophagus, or posterior to the aorta. The inferior thoracic aperture is bounded posteriorly by T12 vertebra, posterior lateral by 11th-12th pair of the ribs, anterior lateral by the joint costal cartilage of 7 to 10, forming the costal margin, anterior by the sternal joint. Ribs and costal cartilages. Ribs are Curved flat bones that form the thoracic case. They are remarkable, light in weight, yet highly resilient. Each rib has spongy inferior cartilage containing bone marrow, which form blood cells. There are three classes of ribs based on their attachment. True, that is called vertebrosternal ribs. False, vertebrochondral ribs, that is 8th to 10th, and floating, that is 11th to 12th. Typical ribs 3rd to 9th have the following parts: head, neck, tubercle of rib, body of rib. Atypically, 1st, 2nd, and 10th through 12th are dissimilar. The first rib is broad, the body is widest, and its cross section is more nearly horizontal. It has the shortest and most sharply curved of 7 row ribs. It contributes more to roof than to the wall of thoracic cavity. It has two shallow horizontal grooves crossing its superior surface for the subclavian vessels separated by scalene, tubercle, and ridge. It articulates only with the T1 vertebra. The second rib is thinner and more typical, except for the formation for attachment of serratus anterior and posterior scalenus muscles, and almost twice the length of the first rib. You can see the image also. The 10th and 12th ribs, likely the first rib, have only one facet on their head. The 10th, 11th, and 12th ribs are short and have no neck or tubercles. Costal cartilages prolong the ribs anteriorly and contribute to the elasticity of the thoracic wall. Intercostal space separate the rib and their costal cartilages from the one another. Space and neurovascular structure are named according to the rib forming on the superior border of the space. That is, there are 11 intercostal space and 11 intercostal nerves. The subcostal space is immediately below the 12th rib, and the anterior ramus of spinal T12 is the subcostal nerve. The thoracic vertebrae are typical vertebrae in that they are independent, have bodies, vertebra arc, and 7 process for muscular and articular connections. Bilateral superior and inferior costal facets, that is also demifacets, on the bodies for articulation with the head of ribs. Atypical thoracic vertebrae have a single whole costal facet in the place of demifacets. Costal facets on their transverse process for articulation with the tubercles of ribs, except for the inferior 2 or 3 thoracic vertebrae. Long inferior slanting spinous process that overlap the 4 disc and vertebra below. Sternum. The sternum is a flat, vertically elongated bone that forms the middle of the anterior part of the thoracic case. The sternum consists 3 parts: manubrium, body, and xiphoid process. The manubrium is superior part is roughly trapezoid bone, and that lies level of the bodies of the T3 to T4. Its superior border is indented centrally by the jugular notch, that is also known as suprasternal notch. On each side, a clavicular notch articulate with the sternum medially of the clavicle. Just inferior to the lateral notch, the costal cartilage of first fuses with the lateral border of the manubrium. The manubrium and body of sternum lie in the slightly different planes, forming projecting sternal angle of twist, which is readily palpable. Clinical mark is located opposite to the second pair of the costal cartilage at the level of 4th disc between T4 and T5. The body of sternum T5 T9 is longer, narrow, and thinner than the manubrium. Its width varies because the scalloping of its lateral border by the costal notches for articulation with the costal cartilage. The xiphoid process T10 vertebra is the smallest and most variable part of the sternum. It's relatively thin and elongated but varies considerably in the form. The process is cartilaginous in young people but more or less ossified in adults. Older than 40 years of age. In elder people, the xiphoid process may fuse with the sternal body. The xiphisternal joint is a midline marker for the superior level of the liver, the central tendon of the diaphragm, and the inferior border of the heart. Joints of the thoracic wall. Although the movement of the joints of the thoracic wall are frequent during the respiration, the range of movement at the individual joint is small. Any disturbance that reduces the mobility of these joints interferes with the respiration. Joints of the thoracic wall occurs between the following structure: vertebra, that is intervertebral joint, ribs and vertebra, costovertebral joints, and sternum and the costal cartilage joint, that is called sternocostal joint, and sternum and clavicle, sternoclavicular joint, and ribs and costal cartilages, costochondral joints, costal cartilages, interchondral joints, parts of sternum, mediastinum and xiphisternal joints. And sometimes the xiphisternal joints are fused in elderly people. The fourth joint between the bodies of adjacent vertebra are joined together by longitudinal ligament and fourth disc. So that's all we will discuss movement of thoracic wall in next lecture. In that whole thing, only important thing is this table joint of the thoracic wall, and also one thing is more important. We have to remember the thoracic vertebrae, typicals, atypicals, and the most important thing in the sternum is the angle, sternal angle. It is also called angle of Lewis. So that's all. Remember that thing more is that typical we have two facets and atypical have only one facets. So that's all. Thanks for watching. मिलते हैं नेक्स्ट लेक्चर में.